Are supplements important for heart health? Okay. In fact, not just supplements, particularly vitamin D and K2, but also aspirin. If blood clot is a problem, then aspirin is a blood thinner. Are you in favor of that?
Right. So, well, aspirin first. So aspirin is, it's blood thinner because it shuts down the healing process. So, like if you get an injury, and you want something to heal, then that's the COX signaling pathway is what will do that. And aspirin will shut that down. And so which will, inhibit a pain signal, it will shut down the inflammation and things like that. And so it will also thin the blood. And so that's what it's used for, or supposedly used for. However, there's no really evidence that a baby aspirin is preventative for a primary heart attack, so a first-time heart attack. There is some evidence that it's useful for prevention of a secondary heart attack, like people's second heart attacks, but I think there's much better ways to induce or to create adequate flow of blood and adequate viscosity of blood than taking an aspirin, because we don't want to shut down that healing pathway, that growth and repair pathway that it does shut down. So things like sunlight and grounding are how we increase blood flow and decrease blood viscosity. Those things are really important. Also, magnesium is very important. So yeah, that can be accomplished those ways without the negative side effects of aspirin, because aspirin, long-term use of it, has also been heavily associated with bleeding, like GI bleeding and things like that. And then vitamin D, I don't really think supplementing with it has shown much benefit. Very few times does it actually increase vitamin D levels. It can be anti-inflammatory just because when you're taking it, but it doesn't really increase the body's amount of it. Right. So in order to get the right increase vitamin D, you have to be in the sun, and you also have to have adequate cholesterol levels and adequate sulfur, because those are the things that the backbones of vitamin D. So you have to have those things with adequate sunlight, and that's what will raise your vitamin D levels, and that's the best way to get it to, because there's so many other benefits of getting sunlight. And then vitamin K2, really, really important for prevention of calcification of the lining of the arteries. But also bone health, because it's what takes vitamin K2 is what's responsible for taking the minerals and depositing where they need to go, like in the teeth and the bones and things like that. It's what Weston Price named the X factor, or vitamin X, or whatever he called it, but he didn't know it was K2 at the time. But that's what these tribes of people that he was studying were so keen on getting, is this K2. But actually, statins can actually interfere with that process. But K2, you're going to find in high amounts in animal foods. So that's the most important way to get them, is in things like liver and egg yolks and butter and grass-fed butter and things like that. Like, we want to get high amounts that way and rely on supplements as little as possible, because they're synthetic vitamins and minerals. They're taken out of isolation of food. We just don't know how well we're absorbing them, and they could also be in different forms. So always try and get as much as you can from food. But yeah, all those nutrients are important, but the way that we get them is also important as well.